So the issue is more when you drink these high acidic mineralized drinks. They do deteriorate the teeth, and typically when that fluid, that soda, sits along the necks of the teeth, it's where the gum actually meets up with the neck of the tooth. So as the neck of the tooth starts to demineralize, or you start to get this decay process, there is a host of bacteria sitting right along the neck of that tooth, and the gum is sitting right there. So the gums start to react to all of that bacteria that's sitting there. So it's not necessarily the soda that's going to cause the gums to become highly inflamed. I mean, nutritionally, it's not ideal because, again, we're going back to providing the right nutrients for the gums to be healthy and well. But when those bacteria start to sit along the necks of the teeth and the tooth starts to demineralize, the gums start to become reactive. It's like touching a hot stove or a thorn. The body's first response is to pull away from that irritant, being the demineralized tooth and the bacteria causing that decay. So the gums pull away. They get swollen, they get red, they start to recede, and then all of a sudden you're starting to deal with early stages of gingivitis. And again, if left untreated, that we know progresses on to periodontal disease or further loss of the gum and the bone destruction. So not only is it nutritionally not great to consume these high energy drinks, or for that matter, honestly, the sodas are not ideal. If you're a person who sips on coffee with a spoonful of sugar or cream in your coffee throughout the day, or a cup of hot tea, and all of a sudden, you're dealing with the sugars, it's that constant overload of sugar to the teeth, and that barrage of sugar just constantly throughout the day is what sets that mouth up for a tremendous amount of deterioration. And not just for teenagers, but as one gets older and they do have receded gums, if the roots of their teeth are exposed, then the root of the tooth is a much softer material than the enamel of the tooth, and it then becomes a much more susceptible site. It's like a hot knife in butter. Those bacteria will just very quickly eat away at the roots of the teeth. So as we age and you deal with dry mouth, you deal with sugary drinks or sodas or coffee or tea, it just puts you at a much greater risk of a higher rate of decay, which makes it more difficult to treat as you get older.